Well, good morning. I have a patient here pretty soon, so I wanted to get this video over and done with. I want to get back on some of the anatomy discussion. I'm not sure where we were last time, so I'm just going to start with low back, hips, and knees today. Real brief. First of all, the low back and the hip they're critically connected inside. And there's a lot of people who come in who have back pain, and actually what they have is anterior pelvic tilt, or perhaps they have one side tilted forward, one side posteriorly tilted. Your pelvis should tilt at about 5 degrees. So if a person was standing to the side and they put their hand on the ASIS and the PSIS, they should have a small tilt towards the front. A lot of people end up having more, though. They have like 10, 15, 20 degrees. I've even seen almost basically 30 degrees tilt. And then very often the other hip, even if it's tilted forward as well, will not be tilted quite as far. And of course that creates a huge disparity. Now, what is the reaction in the body? In statics, we study how forces are counteracted by each other in order to create an equilibrium. The body, even though it's dynamic, needs to create that equilibrium in motion and also for sitting, standing, laying down. So what it does is other muscles that are accessory muscles for stabilizing will also act, and some of them will shorten. For example, the most famous one being piriformis, which wraps around the sciatic nerve in most people. So there's a high potential chance for developing sciatica on account of hip issues. A lot of people think that sciatica, like if they have a pain in the low back, what in the old days they called lumbago, they'll actually call it sciatica. That's not sciatica. Sciatica comes from the butt and then goes down the leg or even skips the hamstrings and goes down to the calf. The lumbago is coming from either L4 or 5 or S1 nerves, and those are going down the sides of the leg usually. You can also develop problems when you have shortening of the muscle. You can develop bursitis, for example. The IT band can be too tight. There could be rubbing along the greater trochanter, which is the knobby bone on the outside of your hip. And furthermore, you can develop instabilities inside your core. So, for example, your abdomen may start to distend out rather than be held in nice and tight, all on account of the shape of the back. Usually that's going to go along with the development of the love handles phenomenon. So if your obliques and your abs start to lose their shape, guess what? Then the back has to work extra hard, and the QL then becomes overly involved. When the QL pinches, that's going to compress the discs. And as we talked about before, the recurve bow of the spine, they may actually create a chain reaction that goes up towards the neck and shoulders. And of course it could go the other way, right? It could start up here and go down, and then from problems up here causing problems in the hips and low back. Now, how do the knees become involved? Well, the IT band is connected on the outside to the lateral cruciate ligaments, and then the inside of the hip muscles, when they get weak or if the hamstrings get weak, they're connected to something called pezanterin or goosefoot on the inside of the knee. And if there's an instability there, that your patella could start to track to the outside, or you can develop the issues of stability. You see the tibia actually rotates slightly when you bend your knee, and so you can develop, if the knee starts to be sitting off of the center, you can develop problems in tracking. And so if you go running on that, develop kind of a Derrick Rose situation where things aren't moving coherently. Of course, you can do a lot of different kinds of solutions to these. There's a PT, and there's weight training, and there's certain athletic events and sports that you can do. I'm in favor of Tai Chi and Qigong because they are a cohesive system that works all together to keep it. And so it becomes all related. The low back and hips becomes directly related to this. If this starts to sag forward, you're going to develop problems in the low back and hips. So all that being pulled back definitely makes a huge difference. When I was young and very healthy, but still played a lot of video games and was sitting like every teenager, I had anterior pelvic tilt, as many kids do. They're, the so-called bubble butt. When that happens, even by 10 degrees, you can create damage in the low back. So it's very important to try and fix that as early as possible and detect it in the young people. Also looking for too much valgus or bowing in of the knees. That can have an effect on the low back and hips as well. So take an assessment of yourself. Look and see if you have too much curve in your low back or perhaps up in your neck and it's affecting your low back. Also look at your knees and see if you are seeing a lack of coherence in your shape. If so, then you need to do corrective exercises. One of the best, of course, is squats. A proper squat, you should be able to pull your toes back and then be on the heels and drop down without bending forward. If you have to bend forward, there's no benefit to you going any lower than where that starts. In fact, if you want to challenge yourself, put yourself up against the wall and put your toes about this far away from the wall and then try and do the squat. If you can't go all the way down and squat like somebody from China or India, then probably you have an instability in your knees and back and hips, and you'd have to go do something to fix that. Martial arts is also another good way of getting that stability. If you're squatting, if you're doing squats or good mornings and you can't do a proper squat as I just described, you need to stop and you need to not do that anymore. And also there are people who are doing good mornings and they're pulling their neck back here. That's very bad. You're going to create compression. You're going to blow a disc at some point and it's going to be a major injury. So if you have any of those problems, you need to stop immediately and begin basic rehab of the squat. And when you squat up, you should squeeze your butt cheeks and stand, of course, nice and erect. And then when you go back down, again, keep your back basically vertical, none of this bending way over. Otherwise, you're going to develop excessive knee dominance and bada bing, bada boom, ACL tears. Probably the number one cause of ACL tears is not actually the repetitive nature of basketball and football, but the jumping and landing when you have anterior pelvic tilt, and so you have a fully loaded knee. Okay, so hopefully that helps you, and if you like that kind of information, like, share, and subscribe, and give this to somebody who you may suspect needs this kind of help and information. Maybe you and a friend or a family member, you can actually test each other, and if you have kids, go ahead and test them out as well. I'll see you next time.